On the line with us is Dr. Brad Ralston, and he is a part of a brand new center here in Indianapolis that deals with educational programs, neurobehavioral and learning difficulties for children. Good morning.
Good morning. Thanks for having me.
Tell me a little bit about the Brain Balance Center. What is that all about?
Certainly. Brain Balance Achievement Center is a supplementary education center, and we focus on children that are having issues with ADD, ADHD, autism, but also learning disorders, reading disorders, math disorders, learning disabilities. Our approach is, largely a three-phase approach in which we look at these children from the standpoint of their neurology. So we focus not on their learning struggles, but more on their neurologic imbalances, and we have a program that's set up to address their sensory motor deficits, their academic cognitive deficits, and we focus on bionutritional intervention as well.
That's a wide range of things to cover for a variety of disorders that are, it seems like that's the big buzzword in our society today, and it seems like it's becoming more and more prevalent as the years go on.
Yes, definitely it is. The research is quite alarming into these disorders from the standpoint that when I started treating children 10 years ago with autism, for example, the autism rates were 1 in 2,500. Some reports are that autism is now shown to be 1 in 38 boys, and that ADHD is the most common diagnosis for children, and that 1 in 6 children will be diagnosed with some problem that will affect their learning or their behavior.
And I think the thing that is most interesting about the Brain Balance program is the non-medical part, because a lot of these disorders seem to get automatically thrown into a pile of pharmaceuticals and medications for treatment.
Certainly. And pharmaceuticals, I think, have been the only, choice that pediatricians have had for a long time. But research is really telling us that these disorders are more global than just brain or psychological disorders, that they involve multiple systems. So research indicates that ADD, ADHD, and autism is due to what we've termed a functional disconnection syndrome, which means one hemisphere of the brain is operating at a higher frequency than the other side. So, for example, the left brain is more learning, reading, writing, math, whereas the right brain is more attention, nonverbal communication, comprehension, understanding the big picture. So we see learning disorders on the left side of the brain and behavioral disorders like ADD, ADHD, and autism on the right side of the brain. And so having that bigger picture understanding helps us to target in on the weaker hemisphere of the child and bring that hemisphere into balance, which is essentially what brain balance is all about. Now, as you touched on, these problems, are so multifactorial. You have, doctors, teachers, parents sitting back and saying, is this a learning problem? Is this a behavior problem? Is this a neurologic problem? Is this a problem with their diet? And so brain balance encompasses all those programs, and the non-medical approach is just basically saying we're going to do whatever it takes, whether it be academic, cognitive, remediation or neurologic treatment or nutritional therapy to get the child to function at a higher level, which is really the key, getting them to function at an age-appropriate level.
And obviously, if you're taking all of those things into account, then it's not a cookie-cutter program. You're really kind of challenge or focusing in on what the issues are for each specific child.
Exactly. We go through an assessment that assesses 1,100 different individual factors for the child, and their program is very customized to their individual needs, in their strengths, their weaknesses, what hemisphere we're stimulating, and we individualize the program so that it meets the child's needs based upon their age-appropriate goals. So when we look at children with functional disconnection syndrome, ultimately they are functioning at a younger neurologic level than their chronological age. So they're somewhat immature in their brain development. And we assess those immaturities and help them to develop skills that will bring them up to an age-appropriate level in academic, cognitive, sensory motor function, behavioral and emotional function, because we find that they're all linked together.
Obviously, since this is a new program, at least in the Indianapolis area, new to me and I'm sure new to several of our listeners, there's going to take some parent education just to familiarize people with the program and the opportunity that lies here with their kids.
It is a relatively a new approach on some research that's been evolving for several years. So new to the Indianapolis area, but I've been here for about 10 years doing Dr. Melillo's approach. And so I'll explain who Dr. Melillo is. He's the pioneer of the Brain Balance program. And he is has been researching and studying and using these applications on these children since the late 90s, treating over 1,000 kids and developing the protocols that now we know as Brain Balance. So we've been evolving to this point for several years now as we've learned more and more about the brain and the underlying causes of these problems. Brain Balance is a multinational or a national franchise that has over 30 centers nationwide, and this is the first center in the Indianapolis area.